General background: Yolk sac tumor, endodermal sinus tumor, represents approximately 20% of all ovarian primitive germ cell neoplasms. It is the second most frequent after dysgerminoma. It usually occurs as a pure form or rarely as a component of a mixed germ cell tumor. Pure yolk sac tumor typically occurs in children, adolescents, and young adults, with a mean age at presentation of 19 years. Yolk sac tumor in adults occurs almost invariably in the setting of a somatic epithelial neoplasm, such as serous carcinoma, endometrioid carcinoma, or carcinosarcoma, which harbors a yolk sac tumor component. These lesions are referred to as somatic yolk sac tumors and are biologically different from pure yolk sac tumors. Like other germ cell neoplasms, this tumor presents as a rapidly enlarging mass associated with abnormal serum markers, particularly alpha-fetoprotein and CA125. Hormonal imbalances may occur, amenorrhea, virilization. Gain of chromosome 12 isochromosome 12p has been documented in most yolk sac tumors of the ovaries. It is usually associated with a favorable prognosis due to chemosensitivity with complete cure in more than 80% of cases. Please remember that immunohistochemical profile of yolk sac tumor. Both glypican-3 and alpha-fetoprotein are useful diagnostic markers of yolk sac tumor. Glypican-3 is more sensitive than alpha-fetoprotein, 100% positive versus 80% positive. Important negative markers include CD30, OCT34, a combination of SALL4 positivity and OCT34 negativity is considered to be highly specific for yolk sac tumor. Prognosis and therapy. Management includes surgery, which can be conservative at least initially, followed by cisplatin-based chemotherapy. Stage is the most important prognostic factor. Overall survival with chemotherapy is more than 95% in patients with stage 1 and 2. And 75% in those with advanced disease. It shows complete cure in more than 80% of cases. Extra ovarian spread occurs in approximately 33% of patients at presentation, usually to the peritoneum, lymph nodes, abdominal viscera, and lungs. Tumor recurrence may occur many years after initial diagnosis, requiring long-term surveillance. Compared to pure yolk sac tumors, somatic yolk sac tumors are highly aggressive and associated with poor outcome, largely driven by the carcinomatous component. Please note that there is some data suggesting that the presence of certain histologic patterns is associated with resistance to chemotherapy, late recurrences, poorer prognosis. These include glandular pattern, hepatoid pattern, parietal pattern, sarcomatoid pattern. Prominent polyvesicular vitelline pattern is associated with more indolent behavior. Thank you.